Hi, I'm Dora, and I am a patient of Dr. Haddock's. I had lap flap breast reconstruction in September of 2022, so I'm about 5 months post-op and doing really great. For my experience, it might be a little different than others and might be the same for some of you, but I was diagnosed with stage 2 triple negative breast cancer in October of 2017. Shortly after, I found out that I had the BRCA2 gene, so instead of doing a lumpectomy, decided to do a double mastectomy after 6 months of chemo. So that happened in May. I had a double mastectomy, and at the time, the only choice I was given was that I could have reconstruction with implants. And I had asked several times if I could have any other option, because implants really wasn't what I wanted to have, knowing that you had to have surgeries down the line, every 10 or 15 years to replace them. I went ahead with the implants and tissue expanders with that. So after having the implant reconstruction, after just dealing with them, I was really hoping to have another option, but going through all the treatments, you don't want to have any more surgery, you don't want to have anything else done. So for 3 years, I kept them and just kind of researching online, part of support groups and things like that, and maybe there's something out there as another option for me. I wasn't a candidate for the deep flap. I didn't have the stomach tissue, so just with online and searching with UT Southwestern, I found Dr. Haddock and I called to make an appointment. I knew he must be good because it took 4 months just to get in for a consultation to see Dr. Haddock, so I felt like I was in a good place and it wasn't an immediate health concern, so waiting 4 months was good for me. So I saw Dr. Haddock and he answered all my questions, and when he said, well, we could probably do it from the back, I was like, there's no way. I was like, that's gonna be enough tissue? And he was like, no, I promise you it'll be, what you have now. So he's like, do you wanna think about it? Are you ready to do this? And that day I was like, no, I'm ready to do this. We scheduled, and about 9 months later, I came in for surgery, and along the way, his staff is absolutely amazing. Any little question you had, they answered it. And another thing that really, really impressed me about Dr. Haddock's office is with the number of doctor's appointments and surgeries that you had. So the very first appointment that I came, I got here early because everybody knows that Dallas traffic is, you just never know, right? So I got here early and I was called in early. I got into the appointment early. So I was sat there and I was like, man, this is I'm in a really, really good place here. But all of the staff has just been wonderful. He answered all the questions. Leading up to surgery, just UT Southwestern in general, when I came in the week before, and they have a pre-surgery appointment, so they go over all of your questions. And in the past, I've had issues with anesthesia after surgery, but they make a plan for you. I probably sat and talked with them for 45 minutes and we went over medications and they listened to what worked and what didn't work. And the next week when I had surgery, I had no nausea when I woke up. I felt really good. I woke up, I wasn't groggy, and I'm pretty sure it was all due to the time that it took, and that's not something I ever had at any other hospitals. It was pretty amazing because I couldn't imagine having to throw up and having the surgery that you have. It was really, really important to me. It's really easy if you need drains removed, any questions that you have, they answer them. He's good for me because he will answer any question you have. He is kind of straight and direct and to the point, but he also has a really comfortable side. You're comfortable when you come in and you meet him, and he is very, very professional, as well as all of his staff. He gave you all the details, and that also is important to me because I love knowing everything, and if I did think of something later, I just messaged and the nurses would get right back to you. And it was funny too, because during COVID the masks were on and you never really saw what they looked like, and then later you did. Dr. Haddock's been absolutely wonderful. This surgery has exceeded my expectations. It's given me a new leaf on life. Not having the implant, you feel whole again, and everything moves right. Your arms aren't kind of restricted, and I know that I don't have to have surgery again in the future. So that's been a really big deal and given back a lot. What they do, the doctors, they're heroes. They really are. After 5 years of hoping that maybe I was a candidate for something else, that a skilled surgeon like Dr. Haddock, there's not many doctors that do what him and the team do here. And I never met Dr. Teosha, but I know that they tag teamed, reading the notes on the surgery. But I couldn't recommend any better place to go for sure. Don't be hesitant to get a second opinion or go somewhere else or wonder if there's a surgeon out there that can do it. Don't settle for the doctor that maybe your breast surgeon has referred you to. You know, take the time to research and see if there's another option, because you don't know what you don't know. You know, you're in the journey and you kind of do the path that they give you, and not that you settle, but you're kind of scared too. There are other options out there, and if you can, you know, take the time and do the research to find the best surgeon capable to meet your body's specific needs. So I have a funny story. So the hospital was amazing. I've had surgery at a lot of different hospitals, and they have everything there for you. They send you home. You even see the physical therapist before you leave, which is awesome. It's about 3 days in the hospital. I wasn't in the ICU. I was just in a private room, which was really nice. I didn't have any complications, so I was lucky there. But on day 2, you get up and you get moving, right? They came to get me up, and off we go walking, and she's like, we're just gonna walk as far as you can. If it's this, we'll turn around. If it's all the way around the block, that's good too. So I take off walking, right? And she's like, whoa, 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 slow down. And I was like, what? I was like, you told me I could walk. She's like, no, 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 you can only walk so fast. And I was like, what? She's like, you can't get your heart rate up over a certain number, you know, because you just had surgery and the blood vessels, they're attached, but they're not like healed together yet. And I was like, I didn't know. She goes, no one's ever taken off on me that fast before. So it was kind of funny. So I made sure that I walked with the walker at home and the sidewalk and everything. But I went home on day 3 in the morning, so I guess about 2.5 days in the hospital. So I got home, and my parents came to stay for a week, and I don't think I would have even needed them that long, except for I have a 7-year-old at home and I needed them getting her up for school and that kind of thing. But the pain was very manageable. I do recommend, if you can have a wedge pillow and do that in the bed, that was very, very helpful for me, because I could just kind of roll to the side and get up. My posture is very good because you had to sit up to make sure, you know, the stitches weren't pulling or doing anything. And they'll give you recommendations on things to eat and food. And I found that I couldn't eat a whole lot. So having just like protein shakes on hand was huge, because you could get one, you could drink it, take your medicine, and, you know, go back to sitting or whatever you needed to do. It's kind of scary going in. It's a major surgery, but I was really surprised at how, I don't know if easy is the word, but it went very well. And by 2 weeks, I was able to drive my little one to school. I drove myself to my, I guess, 3-week post-op appointment all the way down 35. So the hospital puts you in a compression garment when you leave. It's awesome. They give you everything you need. They sent me home with a walker, the compression garments. They even gave you a little tool to put your socks on because you can't bend over yet. So I was really, and they show you how to use it, which is good. But at home, everything is glued. And I don't know, different surgeries could be different, but everything's glued, so there's no washing and cleaning, no changing bandages, so it made it super easy. You could shower right away when you got home because they are glued. It takes a lot of energy out of you though. They tell you to rest, make sure you do rest because your body needs it, believe me. The only unexpected thing I had, which is totally, I don't know how it happened. I guess it was from a medication they had given me. My whole left side, it kind of turned bright red and looked a little swollen. And the nurse came in and she paged Dr. Haddock, and he was there like right away, within like 10 minutes. And I think since he was teaching, he had like 12 people that came with him. So it's a little bit overwhelming, but kind of cool too. So he came in and he took a look. All the Doppler readings were good and they weren't sure. So he went ahead and opened it up and took a look inside, and everything was great, because he's like, if so, we're going back to surgery. And I was like, because you know, they ask you if you had anything to eat or drink, when was the last time? So you know it's serious. So he opened it up, he's like, nope, it looks great, we don't have any issues. So then they went ahead and sewed back up, and they have those Doppler wires. So when I came in to get some drains out the next week, they yanked out the Doppler wires, and when they yanked it out, it actually opened the incision about 1.5 inches. And I didn't really notice it, so when I got home, that was bleeding. And so I just sent a picture to the nurse, and she was like, just put gauze on it and leave it, and like in a week it closed itself back up. I felt like I could get a hold of them at any time. What she told me to do worked, and I didn't have any other issues besides that, I think they give you all the tools that you need, and if you forget or you need something, they don't care. You can bother them or pester them with as many little questions as you want, and they answer back very quickly. Because the message on my chart says they'll get back to you within 24 hours. I think the longest I ever waited was maybe 2 hours, and they get right back to you, so which is very impressive. So my surgery was in September, and I was about 10 weeks post-op. My daughter had her winter dance recital, and as a dance mom, you're running back and forth for costume changes. I had done a quick costume change, and I had to get back out because there was only one number in between. And so as I'm like running down the hall, my chest is bouncing, and I had like tears and like joy all at the same time, because it had been like 5 years since my chest had bounced, because it was natural and that's what they do, but I hadn't experienced that, and it was absolute amazing feeling. And I told them that when I was here, like it's the little things, right, that has given back just so much. And I think the other huge thing, like Dr. Haddock, just to say thank you, is people probably wouldn't notice, but my daughter was 2 when I started treatment, and I went through everything. And with the implants, like I couldn't hold her on my chest. The pain from them was so bad even after they were healed, and even for her to give me a hug, it was really uncomfortable. And now the implants are gone, and I have the lap flap, and I have my own tissue, like she can give me as tight a hug as she wants, and it doesn't hurt. I don't have to push her away or like cringe or anything, and that I think probably has been the most rewarding thing from it. But I just want to say thank you, because without you and your skill set, this wouldn't have been possible. So just thank you and your team too, because I can't say enough nice things. I tell anybody that I know that gets cancer, or just in general, you know, just how well, and they still can't figure out how you made a chest out of the tissue on my back. But it's pretty amazing. So I just want to say thank you to you and your team.